ChatGerry, Footprint of Brain Cell Damage, From Diabetes and Hypertension to Calcification. Number 1354, September 11, 2025. Gerald C. EclaireMD Foundation. Category Diabetes, Hypertension, and Stroke. Preface. On September 11, 2025, I sat with Drive. Neil Schwartz, chairman of the stroke department at Stanford, to review my CT and MRI scans. For the first time, I understood the root of my hemorrhagic stroke. It was not a single accident, but the cumulative result of 3 decades of type 2 diabetes, hidden episodes of high blood pressure, and calcification in my brain's small vessels. This realization aligned closely with what I learned in Professor Jones's MIT classroom in 1972, about nonlinear plastic responses of structures under dynamic loading. Diabetes and vascular damage. I have lived with diabetes for over 30 years. The last 15 years were managed carefully, keeping my hemoglobin A1C around 5.8 to 6.7 without drugs. But earlier 2 decades of poor control left permanent scars. High glucose stiffens arteries, triggers oxidative stress, fuels inflammation, and eventually lays down calcium in vessel walls. Hypertension, seen and unseen. Although I was never labeled as a chronic hypertension patient, the scans told a different story. Many people with diabetes experience masked hypertension. Sudden blood pressure surges at night, early morning, after exercise, or during stress. These spikes injure delicate brain vessels, just as much as sustained hypertension. Over decades, they accumulate into permanent damage. Imaging proof from CT and MRI. My CT scan showed bright white calcium deposits in small brain vessels. MRI revealed white matter changes and microinfarcts. All hallmarks of cerebral small vessel disease. Doctors often link these signs to long-term hypertension, but diabetes and aging can produce the same pattern. Other risk factors: age, chronic kidney disease, and dyslipidemia added to the burden. Together, these factors eroded the resilience of my microcirculation, until one vessel finally ruptured. A systems view of disease. From a scientific view, my case shows the nonlinear, dynamic, and irreversible nature of chronic illness. Disease is not caused by one lab number, but by the integration of many stresses over decades. My viscoplastic energy model, VMT, captures this cumulative effect when long-term data are available. From a personal view, I learned my stroke was not bad luck. It was the predictable outcome of my past physiology. The calcium visible in my CT is the physical footprint of years of metabolic and vascular stress. Lessons. For patients, the message is clear: manage glucose, but also monitor hidden blood pressure surges, control lipids, protect kidneys, and respect lifestyle factors like diet, exercise, sleep and stress. For doctors, the challenge is to see beyond single numbers and adopt a systems perspective. My stroke story is not just about one event. It is about decades of interaction between diabetes, hypertension, and vessel calcification that shaped my brain vessels' health. VMT Appendix. For VMT method details, please search Health Talk with EclaireMD on YouTube. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be edited or republished as your own.